Hi, my name is Caleb Pearce, and I shadowed Rawan Earlwong at Banner University Medical Center's Neuro ICU. As part of my shadow, I got to interview him on aspects of the rotation and pharmacy school in general. I got to tour the Neuro ICU and the hospital pharmacy at Banner, and I got to sit in on some academic journaling with some P4s, some residents, and Dr. Erstedt. I interviewed him and asked him a few questions, and here were the answers that he provided. Practicing as a pharmacist in the neuro ICU means a lot of collaboration with a lot of different healthcare providers. A typical day in the neuro ICU can vary case by case. Days are usually 12 hours long, and you're usually working 12 continuous working days for 2 weeks. Much of the days are spent examining patient charts, planning and implementing treatments, and then monitoring the patients. A pharmacist's duty is to order medications and verify treatments. All the treatments they're giving them are evidence-based. They also just answer any questions that other medical professions on the neuro ICU floor may have. Typically, 2 years of residency are required to work as a pharmacist on the neuro ICU floor. At least one of those years is usually required to be a critical care residency. A P4 on rotation in the neuro ICU does a lot of reading of critical care topics and participating in journaling. I actually got to witness an interesting discussion on loose and tight glucose control in that critical care setting. The P4's day-to-day responsibilities are just to make sure medications are proper, whether that be the dose, whether it's for the right patient, and what time of day it would be given. Projects that a P4 can work on include those journals, the journal discussions, giving presentations, as well as helping make critical care guideline recommendations. His P4 plans after graduation was actually in research and pharmacokinetic modeling. He, in particular, wasn't really interested in the neuro ICU, especially with the demanding hours, and wasn't really looking to work in critical care afterwards. But he did find it to be incredibly helpful to learn all about the neurological disease states. His advice for being successful on rotations was just to show up and try your best. I do think this would be an interesting place to have a rotation. This over other ICUs in Banner in particular was kind of interesting because there were a lot of unique. It's a unique disease state to study and to treat. I wouldn't be working in this setting myself after graduation, but as mentioned, that the hours can be pretty demanding, and some of those cases can be more stressful than others. But I do think it's a good opportunity to have a rotation there.